The anatomical sections that I'm going to show you are arranged to match the CT and MRI sections. So you can see here, for example, the liver is shown to be on this side, exactly the same as you see it in a CT section like this one. It is as if looking at the body from below. In many textbooks, you can still see the anatomical sections as if looking at the body from above, but here, for better understanding of CT and MRI sections, I have inverted these sections so they look the same as the CT and MRI sections. The anatomical sections are selected from the Visible Human project, and for more information about this project you may refer to the following link. Now this is the highest section, and in fact this section shows many structures in the thorax. So just to orient you about this section, this is the anterior aspect, where you can see here this is the sternum and this is a costal cartilage here. Those are some of the ribs, and here posteriorly this is the body of a vertebra. It's a body of a thoracic vertebra, and you can see that within the vertebral canal the spinal cord is located. Of the structures that you see in the section, this is the heart, and here this is the inferior vena cava, as it drains into the right atrium of the heart. And so this is the level where the inferior vena cava passes through the central tendon of the diaphragm, and this is the level of T8. The right dome of the diaphragm is here, and it's because it's higher than the left dome of the diaphragm. Actually here you can see the left dome of the diaphragm, but here the right dome of the diaphragm is not seen. Instead you can see the liver. Part of the liver is shown here because the right dome of the diaphragm is higher than the left dome of the diaphragm. So in the same section you may see the left dome but not the right dome, which is a little bit higher.
This is the diaphragm. This is the right dome of the diaphragm, and here is the left dome of the diaphragm, and this is the region of the central tendon. You can notice that the right dome of the diaphragm is a little bit higher. The central tendon of the diaphragm lies at the level of the xiphisternal joint. Note that the right dome of the diaphragm is higher than the left dome of the diaphragm because of the bulk of the liver, which is present mainly in the right hypochondrium, although it extends into the epigastrium and the left hypochondrium.
On either side of the thoracic cavity you can see the lung. This is the left lung and the right lung. Of the structures that are going to continue into the abdomen, apart from the inferior vena cava, is the esophagus, and behind the esophagus is the aorta. To the right side of the aorta is the azygous vein. In the wall, apart from the skin and subcutaneous connective tissue, superficial fascia, you can see part of pectoralis major here, pectoralis major muscle, and posteriorly this is trapezius, latissimus dorsi, serratus anterior muscle is shown here. This section is a little bit lower than the previous section. This level you cannot see the sternum, instead you see the costal cartilages of the ribs that form the costal margin. In front, traces of rectus abdominis muscle here. Posteriorly, this is the trapezius, the remains of trapezius muscle, and latissimus dorsi muscle. On the lateral side, this is the serratus anterior muscle interdigitating with external oblique. The external oblique arises from lower 8 ribs, and it interdigitates with the serratus anterior muscle that arises from the upper 8 ribs. So there are 4 ribs where they interdigitate with each other. The right side is mostly occupied by the liver here, and you can see that the liver is related to the diaphragm. This is the diaphragm here. Posteriorly here, at this point, is in fact higher than the diaphragm, and it shows traces of the lung, right lung and left lung. Also on the left side we can see the diaphragm. And anterior to the vertebral body you can see the crura of the diaphragm here. This is the right crus of the diaphragm and the left crus of the diaphragm. Note that the esophagus, which we have seen in the previous section here, this esophagus, now the esophagus passes through the right crus of the diaphragm. It has a little bit oblique course as it opens into the stomach. This is the abdominal part of the esophagus, and this section is thus supposed to be at the level of T10 vertebra, where the esophagus passes through the diaphragm. Behind the diaphragm we can see the aorta. This was the aorta in the previous section, and here is the aorta, and on its right side is the azygous vein. The inferior vena cava, you can see it within the liver because it has an intrahepatic course here. It canalizes the liver, and it is receiving here the hepatic veins that open into the inferior vena cava as it passes into the liver. The esophagus opens into the stomach. This is the gastroesophageal junction, and you can see here this is the stomach, which is characterized by the longitudinal folds, the rugae of the stomach. This is fatty material which is located in the omentum. This is the greater omentum, part of the greater omentum that is attached to the greater curvature of the stomach. You can see that the greater omentum contains some vessels which are embedded within the fat. Behind the stomach is the spleen. Returning back to the vertebra, you can see the vertebral body and the vertebral canal containing the spinal cord, and this is the head of a rib articulating with the body of a vertebra at a costovertebral joint, and here you can see that the tubercle of the rib articulates with the transverse process at a costotransverse joint. The true muscles of the back, the erector spinae muscles, are shown here, and they are covered by trapezius muscle and latissimus dorsi. Here again, this is the serratus anterior interdigitating with external oblique muscle, and this is the beginning of the rectus abdominis muscle. The level of the section is at the level of T10, where the esophagus passes through the right crus of the diaphragm. The next section below again shows the costal cartilages of the costal margin. Some of the other features are still here in the wall: the diaphragm, the serratus anterior muscle, latissimus dorsi, the erector spinae. We can still see the spinal cord within the vertebral canal, the right crus, the left crus of the diaphragm, and the aorta behind. This is where the azygous vein starts, and the abdomen by the union of the ascending lumbar and the subcostal vein. And this is the gastroesophageal junction. The stomach, the rugae of the stomach are shown. In the liver, the inferior vena cava, and this is the fissure for the ligamentum venosum, which lies at the same level with the inferior vena cava, and in between the fissure for the ligamentum venosum and the inferior vena cava, this is the caudate lobe of the liver. So the caudate lobe of the liver has a cephalic position, in fact, and is called the caudate because it has a tail, not because it is caudal in position.
In a transverse section lower than the diaphragm, you can expect to find the following abdominal viscera. You can expect to find the spleen here, on the left side, the stomach, the fundus or the body of the stomach, and the gastroesophageal junction might be shown as well, and then the liver might be seen. Of course, here at the same level, the section that passes through the liver will show you the inferior vena cava as it passes through the liver, and the fissure here, this fissure, part of the interlobar fissure, this fissure is called the fissure for the ligamentum venosum, and in between the fissure for ligamentum venosum and the inferior vena cava, the part of the liver here is the caudate lobe of the liver.
The spleen is shown here better than the previous section. You see here the spleen is smaller, but as we go down then we can see most of the spleen. The spleen has a surface that is related to the stomach, as you can see here, and in this section the lung has disappeared. If you compare it with the previous section, you can still see the lungs, but in this section there are no more lungs. We are at a lower level, and this is a part of the large intestine, part of the splenic flexure of the colon. The blue material that you can see here within some of the viscera is due to the material that has been used during the preparation of such sections. This is a CT scan, axial CT scan, almost the same level as this anatomical section. So you can see the liver here, and inside the liver those are the branches of the portal vein. These are branches of the portal vein, and the inferior vena cava, that is the inferior vena cava. The fissure for the ligamentum venosum here, the fissure for the ligamentum venosum. So this piece of the liver, this part of the liver, represents the caudate lobe of the liver. This is the caudate lobe of the liver. On the left side, you can see this is the site of the stomach here. So this is the stomach, and this is the spleen on the left side, where you can see it here in the anatomical section. And here is the aorta which is behind the crura of the diaphragm. Those are the crura of the diaphragm, and behind them is the aorta. The next section is a little bit lower than the previous one. Again, you can see the liver here, and those are the branches of the portal vein. This is the inferior vena cava. This is the diaphragm with its crura anteriorly, and this is the rest of the diaphragm, costal origin of the diaphragm, as the diaphragm arises from the lower 6 ribs. Behind the crura of the diaphragm is the aorta here. On the left side is the stomach. So this is part of the body of the stomach, and this is the pyloric antrum of the stomach. The stomach is characterized by the presence of the longitudinal folds, the rugae, in the stomach. Again, this is the spleen, and it shows the relation with the stomach. The spleen has a gastric surface, and this is part of the large intestine, the colon. That should be the splenic flexure, which is also related to the spleen. The vertebral body, show inside the vertebral body, you can see these are basivertebral veins, veins that drain the vertebral body, and they are drained into the internal vertebral venous plexus, which is located in the epidural space here. And again, you can still see traces of the spinal cord. We are above the level of L2, because at the lower border of L1, beginning of L2, the spinal cord will terminate. So here we are still above the level of L1 vertebra. The next section shows similar features. The liver here, this is the portal vein as it enters into the porta hepatis. So we can see it here within the porta hepatis. This is the inferior vena cava, and the inferior vena cava receives a hepatic vein. So this is a hepatic vein going into the inferior vena cava, and this is the portal vein. Also, you can see part of the stomach here. This is the pyloric region of the stomach, large intestine, splenic flexure, and this is the spleen, and the abdominal aorta behind the crura of the diaphragm. The vertebral body here is showing also some traces of the intervertebral disc, whitish intervertebral disc. Again, we can still see here the spinal cord. Now, some new features are seen in this section. This is the liver on the right side and the region of the porta hepatis, where you can see the portal vein. This is one of its branches of the portal vein. You can see some other vessels here. This one, this is should belong to the hepatic artery, and these are the bile ducts, and they are connected to, partly they are connected to the gallbladder. So this is the gallbladder here, and partly they drain from the liver. So this is a common hepatic duct joining a cystic duct from the gallbladder. This viscus here belongs to the large intestine, and it should be the hepatic flexure of the colon. Again, this is a stomach showing the longitudinal rugae. It is a pyloric region of the stomach. On the left side, you can see the spleen, and coming to the spleen at the hilum of the spleen, these are splenic vessels accompanying this structure, which is the pancreas. In fact, this is the tail of the pancreas and then the body of the pancreas. Because of the obliquity of the pancreas, then we cannot see the entire extent of the pancreas. The head of the pancreas and the neck of the pancreas, the uncinate process, are located at a lower level, and we cannot see it in the same section where we can see the body and tail of the pancreas. It's clear that the tail of the pancreas follows the splenic vessels, and these are located in the lienorenal ligament as they approach the spleen. Also, the spleen, as you can see here, related to the splenic flexure of the colon.
Note that the spleen has a visceral surface and a diaphragmatic surface. The diaphragmatic surface of the spleen is mainly related to the diaphragm, and behind that to the pleura, lower costodiaphragmatic recess of the pleura, and to ribs 9 to 11. The visceral surface of the spleen has a hilum where structures pass in and out of the spleen, and to this hilum is attached two ligaments. One ligament connects the spleen to the left kidney, and this is the lienorenal ligament, and the other one connects the spleen to the stomach, which has been removed now, and this is called the gastrosplenic ligament. At the hilum, you can see the splenic vein and the splenic artery. The splenic artery is a branch of the celiac trunk, and the splenic vein will unite with the superior mesenteric vein to form the portal vein. Also, you notice that at the hilum of the spleen, the pancreas, in fact, the tail of the pancreas extends into the hilum of the spleen. And the tail of the pancreas, together with these vessels, the splenic artery and splenic vein, they are therefore located in the lienorenal ligament, since they extend from the posterior abdominal wall to the spleen. So they reach the spleen through the lienorenal ligament. The spleen, the visceral surface of the spleen, as you can see here, is also related to the kidney, and here this part was related to the stomach. This is the stomach back in position, and you can see how the stomach is related to the visceral surface of the spleen. In fact, there is a ligament, as I mentioned, between the spleen and the stomach, the greater curvature of the stomach, and this is the gastrosplenic ligament. The visceral surface of the spleen is also related to the left colic flexure here. And that's why the left colic flexure is also called the splenic flexure.
And these are some profiles of sections in the small intestine. Now I will leave this structure for the next section and return back to it later on. But for the time being, let's examine this CT scan, axial CT, which has the almost similar features than the anatomical section. So the liver here, you can see the liver, and the gallbladder. This is the gallbladder. Within the liver, you can see the portal vein. Here is the portal vein. The inferior vena cava. This is the inferior vena cava. Crura of the diaphragm, and behind them is the aorta. So these are the crura, and behind them is the aorta. Here, of course, in the cadaver, it has been compressed a little bit. And here you can see the stomach, pyloric region of the stomach. This is the region of the stomach, and behind is the pancreas with the splenic vessels approaching the spleen. So these are the splenic vessels approaching the spleen. In this section, we can see traces of the upper pole of the left kidney. Of course, the left kidney is higher than the right kidney, so it appears in axial sections. Its upper pole appears in axial sections earlier than the upper pole of the right kidney. The right kidney is located beneath the liver, and it is pushed a little bit downwards by the liver. Now this is another section, a little bit down. You can see the liver, inferior vena cava here, and on the visceral surface of the liver, this is the gallbladder here. You can see that the gallbladder, the fundus of the gallbladder, is related to the costal cartilages. Here, this is the 9th costal cartilage supposed to be on the right side. And here you can see clearly the hepatic flexure of the colon. On this side is the splenic flexure of the colon here, because this is the spleen. Again, you can see the pancreas, the body and the tail of the pancreas with the splenic vessels. These are the splenic vessels, the splenic artery and the splenic vein in their way to approach the spleen. Some profiles of the small intestine. You can see the plici circularis inside the small intestine. And this is the pyloric region of the stomach that we have seen in the previous section. This is the pyloric region of the stomach. The pyloric region will give rise to a pyloric canal. It's a pyloric antrum. It will give rise to a pyloric canal. And here you can see the pyloric canal. So this is the pyloric canal, and leading into a pylorus. Note the thickening here at the pylorus, the thickening of the circular muscle fibers forming the pyloric sphincter.
Inside the stomach, you notice here the folds of mucosa. Usually they are longitudinal folds, which are called the rugae of the stomach. And here's the region of the pylorus, the pyloric sphincter, where there is thickening of smooth muscle fibers at the gastroduodenal junction. This is a true anatomical sphincter here.
And this is leading to the first part of a duodenum. So this is the first part of a duodenum. I would like to remind you of the profile that we have seen in the earlier section. This one here. This is the duodenum here. Okay? But until we went to the next section, that we can see the continuity of the pyloric canal and the pyloric sphincter leading into the duodenum. So this is the first part of the duodenum, and behind you can see the portal vein. Again, this is the inferior vena cava receiving the hepatic vein. In this section we can still see the liver, and this is the gallbladder. I will remind you of its position in the previous slide. This is the gallbladder, and here is the gallbladder. This is the hepatic flexure of the colon hepatic flexure in the previous slide. And this is the stomach antrum and the traces of the pyloric canal and pyloric sphincter. So this should be the duodenum. In fact, it is the second part of the duodenum. And so on the medial side of the second part of the duodenum, you can see traces of the pancreas. And this part of the pancreas is the head of the pancreas. In this section where you can see the head of the pancreas, you are unable to see most of the body and the tail of the pancreas, because the body and tail of the pancreas are located at a higher level. We have seen them here and here, but you cannot see the head at this position unless you go down. So this is the region of the head of the pancreas. Behind the head of the pancreas, you can see the portal vein. In fact, the portal vein forms behind the neck of the pancreas. This is again the inferior vena cava, crura of the diaphragm, and the aorta. On the left side, you can see the spleen, splenic flexure. Again, these are profiles of small intestine. You can see the plici circularis within them, and this belongs to colon as well. It's part of the transverse colon here. In this section, we can see the kidney. Again, this is the left kidney, and please remember that the visceral surface of the spleen is related to the kidney as well. So the visceral surface of the spleen is related to the kidney, it is related to the colon, and higher up it is related to the stomach, as you can see here. These are the relations of the visceral surface, in addition to the fact that at the hilum of the spleen, it is related to the tail of the pancreas. This is a CT scan at almost the same level as this section. You can see the liver, gallbladder here. Both kidneys can be seen in this section. Spleen, the aorta behind the crura of the diaphragm, inferior vena cava, portal vein, and part of the pancreas here. This is another section, anatomical section, again showing the liver, the hepatic flexure of the colon. On the left side is the splenic flexure related to the spleen. Here you can see the kidney, the left kidney. On the right side, you can see traces of the upper pole of the right kidney, the two crura of the diaphragm here. Note that the right crus is much thicker than the left crus of the diaphragm. And this is the aorta. The aorta here is giving rise to a branch, which is the celiac trunk. Here is the inferior vena cava, and this is the head of the pancreas, neck of the pancreas. Behind it, the portal vein. Actually, this is the superior mesenteric vein, receiving the splenic vein to form the portal vein. This is the inferior vena cava here. Again, this is the head of the pancreas and the neck of the pancreas here. Profiles of small intestine. Still, we are able to see the spinal cord. So we are above L1. This is mostly at T12, lower border of T12 vertebra, where the origin of the celiac trunk from the abdominal aorta. At a lower level, we can see the liver, the hepatic flexure here. On the left side is the spleen with the splenic flexure, and those two profiles belong to the transverse colon. The transverse colon, because it has a mesentery, so it forms a loop, like a U-shaped loop. So in section, you can see two profiles here. As you section a U, a letter U, you can see two sections of the limbs of the U. Again, the crura of the diaphragm, and this is the abdominal aorta here, with the inferior vena cava on the right side, and the duodenum here. The head of the pancreas is shown, and profiles of small intestine. Both kidneys are clearly shown. Again, we can still see the spinal cord within the vertebral canal. In this section, we can see the liver, the hepatic flexure, the transverse colon here, loops of small intestine again, only traces of the spleen, and this is the descending colon, therefore. And this is the left kidney. Note the hilum of the left kidney, and this section is mostly at the level of L1 vertebra. You can see the branch arising from the anterior aspect of the abdominal aorta. This is the superior mesenteric artery, and this should be the superior mesenteric vein. At a higher section, if we follow this superior mesenteric vein here, we will notice this is again a superior mesenteric vein, and I am following it here. It unites with the splenic vein, and so at a higher level it forms the portal vein. This is the portal vein, this is the portal vein, and you can see here the portal vein is going into the liver. Again, I repeat, this is the portal vein. Now I'm going down. Here's the portal vein in CT, and this is the portal vein here behind the duodenum, and this is the portal vein behind the head of the pancreas. Here's the region of the portal vein, and this is the formation of the portal vein behind the neck of the pancreas. And so below, it is no more portal, it is the superior mesenteric vein. Here again, this is the superior mesenteric vein, and this is the superior mesenteric artery. These loops of small intestine, since we are in the upper part of the abdomen, so mostly they belong to the jejunum here. Now in this section, the striking feature here, if we look at the vertebral canal, is that the spinal cord is no more present. Here you can see that we can still, in the higher level, still we can see traces of the spinal cord, and the spinal cord terminates at the lower border of L1, and so this section should be at the level of L2. This one is at the level of L1. You can see again here that the superior mesenteric artery arises from the abdominal aorta at the level of L1, and this section is at the level of L2. This is the abdominal aorta, and this is an L2 vertebra. You can still see some traces of the intervertebral disc. So inside the vertebral canal there is no more spinal cord. The remaining is the filum terminale and the coda equina are seen here, and we can see the muscles of the posterior abdominal wall. The psoas major muscle here is shown, and the quadratus lumborum muscle. Note that these muscles, they form a posterior boundary of the kidney. This is the kidney, left kidney, and here is the right kidney. Some traces of the liver can be seen on the right side, and this is the ascending colon here. This should be the transverse colon. This is the trough of the U-shaped part of the transverse colon. In a higher section there were two limbs, and here this is the lower part of the U-shaped transverse colon. Again, you can still see traces of the small intestine characterized by the plici circularis inside them. This is the duodenum here, and this is the lower part of the head of the pancreas, which is the uncinate process that is crossed anteriorly by the superior mesenteric vessels, superior mesenteric artery and the superior mesenteric vein. And this is the abdominal aorta here. You can see that on its right side is the inferior vena cava, and the inferior vena cava receives a vein that crosses in front of the abdominal aorta. This is the left renal vein that crosses in front of the abdominal aorta. and enters into the inferior vena cava. In the wall, you can see the rectus abdominis muscle here, and in between the two recti, this is the region of the linea alba. In this axial CT section, which is almost the same level as this anatomical section, you can see here the rectus abdominis, two recti with the linea alba, the muscles, the external oblique, the internal oblique, part of the transverse abdominis here as well, liver, and this is the kidney, right kidney and left kidney. No spinal cord is shown inside the vertebral canal. Psoas major, quadratus lumborum muscle, and these are the superior mesenteric vessels. Note, these are the superior mesenteric vessels. You can see them here, superior mesenteric vessels. And this is the aorta and the inferior vena cava. The aorta and the inferior vena cava. And here you can see the ascending colon. Part of it is shown here. And this is the transverse colon and parts of the small intestine. At a lower level, this is definitely below the level of L1 because we can not see the spinal cord, only the filum terminale and the coda equina. Psoas major muscle, quadratus lumborum. In front of the body of the vertebra, we can see on the left side is the aorta, on the right side is the inferior vena cava. And this is the duodenum, second part giving rise to the third part of a duodenum that continues with the jejunum. And here is the ascending colon, descending colon on the left side. And this is a piece of the transverse colon here. Only a very small trace of the liver can be seen on the right side. Note that here we can still see the right crus of the diaphragm because the right crus of the diaphragm arises from the upper three lumbar vertebrae, but the left crus arises from the upper two lumbar vertebrae. So at this level, there is no more left crus, it's only the right crus that is shown, and we are at the level of L3 vertebra. Superior mesenteric vessels, the artery and vein, cross in front of the third part of the duodenum. Again, in this section, also you can see the third part of the duodenum here. This is the remaining part of the small intestine, the jejunum. Transverse colon, ascending, descending colon, both kidneys are shown, aorta and inferior vena cava, body of a vertebra, vertebral canal showing coda equina and filum terminale. Again, those are the superior mesenteric vessels. They are now passing within the mesentery of the small intestine to supply the jejunum and ileum. And this is another section showing the aorta, inferior vena cava, the kidneys, descending colon, ascending colon, and the transverse colon is shown here. Small intestine, superior mesenteric vessels. Of the muscles, you can see again psoas, quadratus lumborum. This is the erector spinae muscle here, and covered by thoracolumbar fascia, giving rise to the beginning of latissimus dorsi muscle. And we can see clearly the three muscles, forming the anterolateral abdominal wall, external oblique, the internal oblique, and the transverse abdominis muscle. This is the transverse abdominis muscle, and here is the rectus abdominis. On the other side, the rectus abdominis, and in between the two recti is the linea alba. This is another section lower down, showing almost the same previous features. You can see here that the left kidney has almost disappeared. This is the inferior pole of the left kidney, while we can still see a greater amount of the right kidney because the right kidney extends a little bit below the left kidney. because of the position of the liver. Here is the ascending colon and the cecum here, and note the aorta, inferior vena cava, and traces of small intestine. This should be the descending colon, and on this side, as I said, it is the cecum and the ascending colon. Again, you can see the three muscles of the anterior abdominal wall with the rectus abdominis and linea alba. A little bit lower down, now you can see very clearly that this is the cecum on the right side, and this is the descending colon on the left side. The three muscles are shown here: external oblique, internal oblique, and transverse abdominis. The rectus abdominis muscle. You can see here the splitting of the aponeurosis of the internal oblique muscle, partly to form the anterior wall of the rectus sheath and partly to form the posterior wall of the rectus sheath. Aorta, inferior vena cava. There is no more left kidney, but we can still see the right kidney in this section. Here again the cecum, and this is the terminal part of the ileum here, approaching the cecum. These pieces belong to the ileum. This is the terminal part of the ileum. Aorta and inferior vena cava. Again, you can still see a trace of the right kidney, but there is no more left kidney. And the three muscles of the anterolateral abdominal wall with the rectus abdominis muscle here, psoas and quadratus lumborum. This is another section below showing the cecum, ileum, and pieces of jejunum. You can compare the pieces of jejunum here. They have a lot of these plici circularis, the circular folds, while there are very few in the inside of the ileum. This is the descending colon, and this is again the region of the cecum. Here is the aorta and inferior vena cava. This is an intervertebral disc here, whitish in appearance. Now let's go to the next section. Again, you can see the aorta, inferior vena cava, psoas, quadratus lumborum, the three muscles. And note the contribution of the aponeuroses of these three muscles to the rectus sheath. Anterior layer of the rectus sheath is formed by the aponeurosis of external oblique and part of that of the internal oblique. And the posterior layer of the rectus sheath, here again, is formed partly by the aponeurosis of internal oblique and by the aponeuroses of the transverse abdominis muscle. Aorta, inferior vena cava. Now we are at a lower level, showing the cecum on the right side. On the left side, this is the descending colon. Those are loops of ileum. Again, I repeat that they show a little of the plici circularis, unlike the loops of the jejunum that we have seen in the upper part of the abdomen. Of the muscles, we have the psoas, quadratus lumborum, and the external, internal oblique muscles, transverse abdominis and the rectus abdominis muscle. And here is the linea alba. Going a little bit down, you can see here that the aorta has bifurcated. So this is at the level of L4 vertebra. Inferior vena cava is still one tube because the inferior vena cava forms at the level of L5. So at the level of L4 it is already formed, but the aorta splits into two common iliac arteries. So these are the common iliac arteries, the terminal branches of the abdominal aorta. And this is the level of L4. You can see that on the anterior abdominal wall there is the dimple here, which is formed by the umbilicus, beginning of the umbilicus. It's almost at the same level of L4.
The abdominal aorta bifurcates at the level of L4 here. And you can see that the inferior vena cava extends more distally than the aorta. So the inferior vena cava is formed at a distal level, at a lower level, at the level of L5. And that's why in sections at the level of L4, for example, usually these sections pass through the umbilicus, although the umbilicus is not a reliable surface anatomical landmark. But a section at the level of L4 will show you the bifurcation of the aorta into two common iliac arteries, but will show you a single inferior vena cava. It has not. It will not show the common iliac veins. The section at the level of L4 vertebra.
This is the cecum, and joined by the terminal ilium here. So these are ilial loops, and here is the descending colon. At this level, we can see the cecum again, and the iliocecal junction. Now you can see the ilium in continuity with the cecum. The umbilicus is very clear here. Rectus abdominis, linea alba. And again, you can see the splitting of the aorta is very clear. Inferior vena cava is still in one vessel. And here is the descending colon on the right side. You can see the iliac crest here posteriorly. And this is the iliacus muscle. This is the psoas. No more quadratus lumborum is shown because quadratus lumborum arises from the iliac crest, and you can see it in higher sections. So here you can see quadratus lumborum, but once the iliac crest is shown, this is a level a little bit below the iliac crest. There is no more quadratus lumborum. We can see the iliacus muscle from the inside in the iliac fossa, and the outside here, this is the gluteal surface where we can see the gluteal muscles. This is the gluteus medius muscle, in fact. And those are the erector spinae muscles.
You can see here the psoas major muscle. This is the psoas major muscle. And you notice that psoas major muscle is related anteriorly. It's related to the kidneys. So if we go back to the relations of the posterior aspect of the kidney, the upper part will be related to the diaphragm, while the lower part medially is related to the psoas. And then just lateral to the psoas, the other muscle is quadratus lumborum muscle. And then the transverse abdominis. So this is the transverse abdominis here that continues onto the anterior abdominal wall, while quadratus lumborum extends from the 12th rib to the iliac crest, and medially it is attached to the transverse processes of lumbar vertebrae. So here we have the three muscles, the psoas, quadratus lumborum, and transverse abdominis muscle. Again here, the psoas, quadratus lumborum, and transverse abdominis muscle. This muscle here is the iliacus muscle. It is present in the iliac fossa. This is the iliacus muscle, and you can see here that the iliacus will join the psoas to form a common tendon, the iliopsoas, that passes beneath the inguinal ligament again and is attached to the lesser trochanter of the femur. But the iliacus is not attached to the spine. Superiorly, it is not attached to the spine. But the psoas is the muscle that is attached to the spine.
This is a CT section, almost at the same level as the anatomical section. So you can see the iliac crest, iliacus from the inside, gluteal muscle, gluteus medius, and this is the psoas major muscle. Here is the psoas major. You can see the two common iliac vessels, and this is the inferior vena cava here. Those are loops of small intestine, mostly the ileum, and this is the cecum here, and the descending colon on the left side. You can see the three layers of the anterolateral abdominal wall muscles: external oblique, internal oblique, transverse abdominis, and these are the rectus muscles, and in between them is the linea alba.